Welcome to this special edition of the Ophthalmology Experience powered by Boost Patients. This is not a typical episode. We're doing this to try to raise awareness for interventional glaucoma and why it's crucial for patients and the practice. So today we're joined by Kathy Disner and also Dr. Dana Wallace. Thank you so much for joining. I believe both of you are going to be presenting at the upcoming meeting of the Business of Interventional Glaucoma in April. And so very, very glad to have you and ask you a few questions. And hopefully we can pique the interest enough of anyone who's listening to this so they can come to the meeting and get more information from the experts. I am one of those people. I will be attending as an attendee. So I'm really excited to learn more from you and the other people presenting. So thank you so much for joining us today.
Thank you. Pleasure.
Thank you for having me.
Awesome. So at a high level, if someone were thinking about attending this meeting, what practical tools, what frameworks or playbooks can someone attending the meeting walk away with? And Dr. Wallace, I'll start with you.
Sure. I had a great experience at the Business of Interventional Glaucoma meeting last year. And I thought it was great to have focused time with both the physicians and administrators to be able to roll out exciting changes within your practice to help improve your patient experience and patient outcomes. There's been so many new innovations and medicine and surgery for medicine in terms of delivery devices and also in terms of glaucoma surgeries to help decrease drop dependence for patients, and learning how to implement those effectively and deliver them to as many patients as possible, because we know that it does improve outcomes, is helpful. But it does involve knowing how to do the billing, how to present it to the patients, how to market it to the patients. It really requires all of those aspects in order to be successful. And so I think the summit is really helpful in connecting all of those pieces.
Yeah, that makes sense. And that's why we have Kathy with us today, too, to round out the loop. So what do you think people will take away from, like what she said, the coding and billing and that piece of
I
it?
think just real direction, clear paths within their entire office, swim lanes. Everyone has their lane from the front office to the techs, to the physicians, to the schedulers, to billing. Um,
Mhm.
Patient pathway templates, clear tech scripts as far as templates. Everyone's on the same language. The same message is getting repeated to the patient. Just real staff organization to increase the IG volume.
Yeah, no, that makes sense. And a follow-up question to that is, so practices that are either very heavy in a certain specialty, like whether it be retina or like us, cataract refractive, you mentioned text scripts and it seems pretty involved. Is it possible for practices that are very heavy in other specialties to implement something like this alongside what their primary focus might be if it's not interventional glaucoma?
Absolutely. Any specialty, if you have a script, everyone's on the same page. The message is getting across to whatever that physician, whatever the specialist wants for that patient to hear. Everyone's on the same page. Everyone has the same message. There, it eliminates uncertainty from the tech, gives them confidence on how to communicate with the patient, and it really helps as far as that information flow.
Okay. Yes, that's why I'm coming, because I want to learn how to implement them side by side and make it successful. Uh, so, Dr. Wallace's questions for you. So, practices that are still very dependent on treating glaucoma with drops, with traditional pathways. How can a practice find hidden efficiencies, hidden opportunities for better patient care when approaching it using the pathways that you guys will probably talk about at the meeting?
Yes, there is unfortunately still many patients who have to use drops of some sort.
Mhm.
But we have found that by using the technicians. A patient mentions that the drops are irritating their eyes. Using the technician to be like, well, there are some things that maybe Dr. Wallace can talk with you about. And while every IG procedure may not be possible for each patient, it does help open up those lines of communication with that patient.
Mhm.
And it keeps the technicians involved and not just thinking like, well, I can't talk about it in this patient. And it becomes too confusing if they are
Yeah.
trying to sort out for themselves which patients are candidates, but
Mhm.
just little cues from things that the patients may say during the workup to help them reinforce that there are IG procedures that they may or may not be a candidate for, and that sets you up as a physician going into the room.
Right. So it sounds like a big part of creating these pathways for interventional glaucoma are a lot about education, education for staff, and really educating patients on a different way to approach treating their disease. Is that correct, Dr. Wallace?
Yes, and one thing that I found helpful at Biggs is learning how other practices have helped to roll out education within their practice. We've
Mhm.
used text messaging a lot in our practice, but others have done online videos, and just seeing how what other practices have found to be helpful can really make a difference and bring new ideas to how you outreach to your patients.
Yeah, no, that makes sense. One of the biggest challenges, probably in anything we do, is education. So any new way to deliver that is a breath of fresh air. And so
Yes.
looking forward to learning more. Kathy, this question is for you. What does a successful interventional glaucoma program look like from a workflow and also a staffing perspective? Do we have to add more staff to do something like this?
No, actually, I'm not saying it eliminates staff, but everyone is more focused. They know what their job is, they know what their role is, and we set expectations, and we follow that patient pathway. We have certain protocol. They know what the MD expects, as far
Mhm.
as pre-exam, testing. Everybody has their role, everyone has their expectations, and because of that, it runs much more efficiently.
Yeah, no, that makes sense. And the next question I have is similar to the question that I asked you, and this can be for either one of you. I can, Dr. Wallace, if you can start. But so, if a practice is trying to align a strategy with physicians, administrators, and technicians, and other support staff, what's the best way to form alignment?
Uh, what we have found helpful is really emphasizing the positives for patient care and patient outcomes. That helps get
Mhm.
the administrators, the staff excited about bringing these options to the patient. So, getting everyone excited about these procedures helps them stay committed and following through on all aspects of it. I think sometimes the physician gets excited about it, and because the staff may not really understand what this can deliver to the patient, it's hard
Yeah.
for them to get on board. So the education piece, not just focused at the patients, but also focused at the staff and making everyone them see how well these patients are going to do once you get going with interventional glaucoma.
Yeah, makes sense. Kathy, same questions to you. How do we get alignment?
We get alignment from making sure we all have the same message. We have a certain language, certain vocabulary, and if we're all on board, that's our strategy. From the doctor to the front office, everybody. And with that, we have repeated messaging. The front office understands the procedure. They understand what's involved, the teching with their questions and their communications with the patients. And then once
Mhm.
everybody adopts to an IG focused practice, that's when our conversion will skyrocket. The adoption will skyrocket.
Quick break brought to you by Boost Patients. If you're listening to this podcast, you're probably a physician, a practice admin, or maybe someone on the marketing team, and you really have a singular goal. You want new patients, more consults, higher surgery volume. And oftentimes, when you want that, you think immediately about marketing, spending more on marketing, investing more in marketing. Maybe, but probably not. We've mystery shopped over 600 practices, and there's one commonality with all of them. They're not very effective and not very good at patient follow-up. So before you invest more money in marketing and more into that investment, you really need to understand how your practice is following up with new patients. So go to boostpatients.com, fill out the contact us form, and let me know that you want us to mystery shop your practice. We'll mystery shop it. We'll document how your practice follows up with your new patient lanes, and we'll share that information with you. Now back to the show.
Yeah, no, that makes total sense. Um, Dr. Wallace, I have a question for you. In terms of interventional glaucoma, why is it better for patient care and outcomes?
I know our practice is extremely burdened by tasks from phone calls
Yeah.
of prior authorizations for medications, uh, pharmacies being out of stock, difficulties with the medications, redness, irritation, you name it. We've all seen the variety of complaints. It's a big administrative burden. One of my scribes can probably sit there half the day responding to prior authorization and tasks. And it
Mhm.
also takes a lot of chair time for the physician. In addition, we know that when patients are having all of these side effects, they're not as compliant with the medications. You know, when they're asking you like, okay, I have such and such event coming up. I don't want to have red eyes.
Mhm.
Is it okay if I miss? You know that they're missing many other times, not just this one time for a special event. So decreasing the dependence on drops is really impactful for patients. It improves their outcome because there's less pressure fluctuations. It improves their compliance and adherence because they're not dependent on whatever formulary change, coupon is available, whatever specialty pharmacy we're sending the drop to every 6 months. It's a lot of administrative burden for the practice and for the patients keeping track of where they need to get their variety of medications from. So interventional glaucoma really can be transformational. When a patient comes off of all the drops, you know, they gain so much time back from their life. So,
Yeah. And you intervene as the title is where you help patients avoid losing sight. And
yes,
because as we just discussed, education is can be key for patients and staff, and a lot of times that is a challenge for patients to really understand how to be compliant, and doing more of these interventional procedures can help eliminate or at least reduce it, right?
yes.
um, so we know it's better for patients. Kathy, this question is for you. Can an IG strategy also be good for the bottom line as well? Can it be good for the business?
It would be beneficial both clinically and financial. Because once you streamline, you hit your markets, you know you're managing your IOPs, you're managing, as far as the long-term stability of patients. Now you're decreasing your employee time, your staff time with prescription refills. That's allowing more time within the clinic. It's definitely a return on your ROI. Um, Once your clinic strategy is met, it's gonna drain your operational responsibilities and a lot of those efforts, so that will be up for
Mhm.
an success.
Yeah. Yeah, that's awesome. And when Dr. Wallace mentioned the reducing the amount of prior auths and callbacks, and that's a way to get your staff on board, right? You tell them, hey, you guys do this right, help educate patients. You don't have to deal with all these prior auths.
Monday is saved. So,
Right, right. Um, so what about misconceptions? What about myths? Do people come up to you, before or after a program and say, I'm struggling with, or if I do this, it's going to take focus away? Or what are some of the biggest misconceptions that you may have heard? I'll start with you, Dr. Wallace.
they can be varied. You know, I've had other physicians say, patients on one drop, they have mild glaucoma. They don't need stents at the time of cataract surgery. um, they
Hmm.
may not be interested. How hard is it to take one drop a day? So on milder stages of disease, you know, you could have pushback from that's really not impactful for the patient to have that procedure at the time of their cataract surgery. And then there's also, minimally effective glaucoma surgery and procedures, and whether we can really make a difference in some of the patients with advanced glaucoma. And really, with some of the newer procedures that we have, I feel that my rate of patients who have gone on to need trabs and tubes has decreased. With surgeries that have a much less recovery time, much less post-op. Um, so, yes, these procedures are not great for everyone, but
Mhm.
on both ends of the spectrum, I have had many patients who've really benefited, both with mild glaucoma and with advanced glaucoma.
And Kathy, any myths or misconceptions that you can think of?
Not any real misconceptions. Patients come into our practice with an anticipation of some sort of procedure. Um,
Mhm.
but it's when the message is out there that there are alternatives. And that's the big message is there are alternatives to all of the drops that you're taking. You may not eliminate completely, um, but it will definitely improve your lifestyle. And that's the message that we have for the patient.
Yeah, that's great. My last question is, okay, I'm listening to this and I'm kind of on the fence. Do I go to that extra day in DC and go listen to people talk about interventional glaucoma? Dr. Wallace, why do you think it would be beneficial for someone to come listen to you all talk about this?
I think for the physicians, you really get a lot more. It's very impactful to learn things outside of just the clinical framework. What you can bring to the administrative staff, how you can effectively make sure your billing and coding are going well. Those are things that can really help round out your practice, and help you be more effective in implementing it at home. I think for us, on the clinical side of the meeting at Escris, there's so many fantastic talks. Um, and that's very important too. But having your administrator there or having specific things that you can bring back to your administrator, to your marketing team, things that you can roll out in an easy, simple way in your clinic from the first day that you get back is really helpful and different than the other things that you can get from other ASCRIS talks.
Yeah, no, I agree 100%. I think, as you make your clinical decisions as far as how you treat your patients, understanding the components that connect to how you give that care are very key so that when you are making those decisions, you take those things into account and you can make sure that you're not going forward with a strategy that's going to create administrative burdens that are going to prevent you from providing that care, depending on what it is. So I agree 100%. Kathy, how about from your perspective? Why should people come?
From an administrative point of view, they should come because you're going to get the tools, you're going to get the patient pathway templates, you're going to get the tech script templates as far as ideas on how to get that communication between your staff and your patient, consistent protocols as far as what steps, what procedures, whether it's an SLT, a MIG, or any other next steps. Just real defined practice procedures and information like that.
Yeah, that's awesome. Well, I really appreciate both of you taking the time to kind of explain a little bit about interventional glaucoma, why it's important to get together and learn strategies on being successful. And I really hope that many more people register to come hear the experts talk about it. So thank you so much for joining me today.
Thank
Thank
you.
you.
Yeah, and I also want to thank the listeners for joining. And I also want to give a shout out to Boost Patients for helping produce a podcast. And please, come to DC. Come on the Thursday. I'm going to be there. If you want to say hello to me and you want to be a guest on the podcast, we can talk about that too. Thanks again, and everyone have a great week.